This is Dr. Jonathan Lebowitz, the Long Island Gynecomastia Center, the Long Island VaserLipo Center, and I'm adding to my YouTube video channel a further case of gynecomastia. So gynecomastia really means a woman-like breasts, and people tell me all the time, how do I know I got gynecomastia? And there's two types of gynecomastia. There's younger kids or skinny kids, you know, maybe teenagers and maybe older guys that are very, very, very fit, who just have nipple rocks, just kind of gland underneath there, and the shape of their pec muscle is superb, and they're in shape, and all they need is the gland removed. And there's the second type that's got a little fat in the chest. Everybody has gland, and all the time the gland needs to be removed. That's ground zero on both sides. But like in this gentleman here, he's got a little extra fat all around here. So it would be not a perfect operation if I would just go in there and remove the gland, because he wouldn't have a shape of his pectoralis major muscle. Indeed, he does need to lose a little weight, and he acknowledges that and is going to try to kind of do that. But we're going to jumpstart his confidence by sculpting and contouring high-definition physique his chest. So I'm going to show you my markings for the Vaser liposuction. This will be done under local anesthesia. He'll be awake, perfect results, because he's cooperative, and I'll turn him and twist him. He'll lift up his arm and down his arm so I can sculpt high-definition physique for extraordinary results. So my markings are as follows. High-definition physique is all about negative spaces and positive spaces. We want a nice full shape of his upper chest here, so and not do much liposuction, so he's got an semblance of a great muscle, but we want a negative space here and a negative space here to really fine-tune his chest. We want to keep the shape here. This we want to keep. We don't want to make him too flat up here, because we want some bulk up there to give him a shape of his muscle. Make a sad chest into a happy chest, and that's what we're going to do. There is a rhomboid shape, negative space that I want to create here. That's the medial border of the pec muscle on both sides, and the superior border of the rectus up there to give him that first inscription. Little areas that we're going to do. We're going to have like a 4 millimeter little cut here. I make it so small, and literally I have to put in just 2 stitches at most. And that's the gland that we have to remove, that rubbery gland that won't be removed with the Vaser itself. And then he's going to have push down again. He's going to have a little bit of a 2 millimeter stab right there to get that shape. Through this little one, I can Vaser all around and up and be perfect. That's it. These are my markings for the high definition Vaser Gynecomastia Center liposuction and gland removal for extraordinary results. In a minute, we're going to invite you into the operating room, where I'll have completed the local anesthesia, and we'll show you the procedure. See you in the operating room in a few minutes. So here we are back in the operating room. I've already numbed them up, and you can appreciate the whiteness, the vasoconstriction, because of the tumescence that I use has epinephrine and lidocaine in it, and a little bicarb to stop the little stinging by modulating the pH. And I'm using the 5-ring probe, which gives 75% of the energy around it and only 25 at the top, because I want to melt and contour high definition for his high definition physique. And here we go. Put it right through that port, and you can hear the sound. And it's ultrasound, almost like an electric ultrasound toothbrush. You can feel me kind of hitting that ground zero gland right there. I'm hitting it. And this makes a hamburger into a slider. A hamburger into the slider. We're doing the central part, the inferior border of his pec muscle right here. You right? And bring it up to the lateral border of the pec muscle right there. You can see it right underneath the skin. So let's concentrate right now on emulsifying and breaking up this gland so I can make the teeniest incision to get it out for extraordinary Dr. Lebowitz, body by Lebowitz, chest by Lebowitz results. And you're going to see some fluid coming out. That's the fat that we just can't contain. Can't contain the fat. Can't contain the fat. You all right? And it's under local. Feel anything? Pain from 1 to 10? What is it? A 0? A nothing. Now we're going to go to this negative space right here. And this is the space between the lateral aspect of his pec muscle and the anterior aspect of his lats. It's all about positive and negative spaces, light shadowing to give extraordinary results. Remember that rhomboid we talked about right in the center? Right there. So this is ground zero right here. This is what we have to get. And you can kind of see as I do it, right by the nipple, how it's being tethered. And that's the gland. So here we go on the other side. Inferior border of the pectus, right here. Inferior border of the pectoralis major muscle, that little rhomboid, which is the medial inferior aspect of the pec, and the medial superior aspect of the rectus muscle. So here we go on this side, ground zero, underneath that nipple. That's where the gland is. And a shout out to my friends at the Doctor's Toy Store in Hallandale Beach, Florida, who supplied the Vaser, Power X, which I'm going to use in a minute, and that cautery to get the gland out without blood, without seroma, without bleeding, for perfect, extraordinary results. And I'm one of the only ones in the world that does this under local. A lot of doctors just don't want to be bothered hearing from the patients and dealing with patients. I actually enjoy it. All right, let's go down here. So this is the negative space I was talking about. The space between the lateral part of the pec muscle and the anterior part of the lats. protectors. You all right? Cool. So we're halfway done. So now we're going to do some Power X. So this is my Power X tool. It suctions and it vibrates, or it goes back and forth. And a little cream to protect it. And here we go. If you feel anything, let me know. So now we sculpt. So we melted, and now we sculpt. You all right? So what this Power X does, it saves my shoulder, basically. Get that nice fine tuning, get this negative space right here. That's what it's all about, positive and negative spaces. We want that beautiful negative space between the lateral aspects of the pec muscle and the anterior portion of the latissimus dorsi muscle right there. And here's the fat coming out. You can see it. A sad pec into a happy pec, right? What do you want? Happy pec or sad pec? Happy pec. Concentrate on ground zero right here. So this is the little bit of gland left there, that little nubbing right there. And that's what, just underneath that nipple for perfect results. And some doctors would stop at the lipo and not do the gland. And let's do this side. Perfect. So now, made a little 4mm incision, much smaller than I used to. And we're going to get this rubbery gland out. So the gland is white and fat is yellow. Don't need to take any fat out again because we've already lipoed it. So, but some will come out with the gland, just because it's adherent to it. So these are the two glands I got from the sides. Again, I did a big meatball into a little tiny slider on both sides. So the incision, as you saw, is so petite, so small. So this is my cautery. It's the best cautery in the world. Again, bought at the doctor's toy store. And I'm just cauterizing some fat, and this is actually insulated there, so the top that works is just there. So next we have a little
little teeny retractor. Get right in there so I can see. Make sure again there's no fat that's lurking. So make sure there's nothing going on, because a lot of my patients come from out of state, so I don't want them to have any problems, and just very cautious about everything. Perfect. So this is a little drain. I use a drain most of the time now. There was times where I didn't use a drain, times where I did. I find the drains come out with the dressing, with the first dressing change. So the drain comes out. This is underneath the dressing, so he doesn't even know that it's there. It drains right into the dressing. So that's it. This is the incision. Let's go on the other side. Look at that. So we're done with the procedure. Everything went great. Then these are the two glands that we got out after whittling it away. Tiny, tiny glands out of a teeny incision. And I only put in just a couple of stitches, and he's going to get an excellent result. We're going to put on a compression garment on him right now and put him into the recovery room, and he's going to drive himself back home. He lives about 2 hours away. Going to drive himself back home. I'm going to see him in 48 hours to do the first dressing change. That little rubber band drain will take out at that time. The drain will drain into this thing, so he doesn't, into the dressing, so he doesn't know anything that's even there, and he doesn't have to be bothered with it. So now we're going to get the garment on him. And this is the compression garment. He's got to wear for 6 weeks. Get him over your head. Ready, on your mark, get set, go. You got it? Good. So this is Dr. Jonathan Lebowitz of Lebowitz Plastic Surgery, the Long Island Gynecomastia Center, the Long Island VaserLipo Center, and we just completed a case of gynecomastia on this gentleman. We used Vaser liposuction, Power X power liposuction, and we removed almost 900 cc's of fat from him and those tiny little glands that we whittled down from a hamburger to a meatball. We did a little incision, about 4 millimeters, the edge of the areola where the water meets the beach, and we got out those glands. So the scarring is really nothing. The scars are really nothing. If you're interested in gynecomastia surgery for extraordinary results, please call me, Dr. Jonathan Lebowitz of Lebowitz Plastic Surgery, located in Huntington, Long Island, New York. 631-424-0101, 631-424-0101. Hope to see you soon. Thank you.